Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the episode for you today? As promised, I'm bringing you plastic surgeons from across the country that can deliver you the results that you're looking for. And today, I'm so excited to have Dr. Tony Weaver from Huntsville, Alabama on the show. Thank you so much for being on the show, Dr. Weaver.
Thank you, Mavi. It's such a pleasure to be on the show. I followed your podcast and watched your journey on social media, and it's truly inspiring. You just provide such quality for everyone, and I consider it an honor to be on the show.
Oh, thank you so much. I appreciate that. I am so happy to hear that my show and everything, my efforts have really made an impact, not just on my listeners, but on the surgeons around me who see, hey, this Mavi's working on this. She's helping us out over here. So today we're going to get into such a good topic. Oh my God, you guys, y'all are in for a treat. So as y'all know, we have a multitude of procedures that can be done during plastic surgery. And the topic that we're going to be talking about today is breast. And Dr. Weaver is a breast expert. So we are going to really unravel the myths, the misconceptions, the facts, and the false of breast augmentation, breast lift, breast reduction, fat transfer, the whole shebang. So Dr. Weaver, thank you so much for helping us unravel what's on social media, what's out there, and really get to the bottom of it. Is it true? Is it not true? What should I do? So for today's episode, we're going to pretend we have two patients. One is a primary. This is the first time she's going to get anything done to her breast, and she's considering something. She doesn't know exactly what she wants, but she wants something. And she's heard maybe some things online about implants, that they're bad for you. So she might be considering fat transfer. And on the other hand, we have another patient who has already had implants and just doesn't know, should I switch them out? Are they going to make me sick? I don't know. So these are our two patients for today, and I really want us to help our audience and our imaginary patients navigate through that journey.
Yeah, I'm excited. And Mavi, I think the two scenarios that you've described are so common. And they are so different too. So even though, one breast surgery may sound or may seem similar, every surgery, every patient, every encounter is completely different, and it's completely unique in and of itself. So it's really important for women to have good information and also to understand what applies to them and what may not apply to them. So these two scenarios, sure, they're both breast patients, but they are, and wildly different in so many different ways, and there are different complexities involved with both. I think breast surgery for a long time has sort of been, it carries this almost misconception that it's just a simple, super easy procedure. And I think to an extent, some of the procedures of primary augmentation, sure, step by step, is it a simple procedure? Most definitely. But is it a very, very difficult procedure to master? Absolutely. And that's where we come in with figuring out what the patient wants, what her expectations are, what she doesn't want is probably even more important, and then finding ways for us to work together to achieve those results.
Absolutely. One of the reasons why I wanted to have you on the show, Dr. Weaver, is I love highlighting surgeons that really take an emphasis on the patient experience and on listening to their patients and helping them through the journey. I want my audience to get to know you a little bit more. So will you tell us, how did you get started in plastic surgery? Tell us all about yourself.
Yeah, certainly. So I'm from a small town in South Alabama originally, and I think it's really difficult. You know, nowadays you see a little bit more of people incorporating their own unique background into their practice. There used to always be this separation between your professional life and your personal life, but I think it's impossible really to separate that out, because my personal life really helped to develop my professional life. So the mission of what we do within our practice is to deliver exceptional care, exceptional results. And we do that through exceptional level of compassion, understanding, and listening to our patients. And so we see what we do every day as an extension of what we do outside of the office. So my goal as a person, not just as a physician, because I'm a person first, and then I'm a physician. You know, being a surgeon, that's not my identity, Mavi. It's my profession, but I'm not defined by that. I'm defined by how I treat people and how we're able to help people at the end of the day. So some of us do that with surgery. Some of us do that in other ways within our profession, and some of us just do that through our relationships that we have with people. And that's what surgery really is building a relationship with someone, and it's probably one of the most unique, and I would say it should be one of the most cherished relationships, because when you think of the level of trust that a patient gives a surgeon, you know, what other field or what other profession or situation or scenario would someone completely trust you with their body, with their total existence? Because most of the time patients are going to sleep under anesthesia. They are completely trusting us to take care of them. And then we take a perfectly healthy patient in many instances, and we take a knife and we cut on them. So there's a level of trust between both parties that I think is unlike any other relationship that there is, and so I consider that a privilege. So the why of what I do comes from my faith and what I believe. The what I do, you know, it comes from my relationship with the patient, and the how I do that, it also goes back to both of those things together: my faith, the relationship with the patient, what the patient's expectations are, and how can we get you there in the cheapest or least expensive way, but in the safest way, with the best outcome. And that's how and why I do what I do. And that all stems from my faith, family, and mission in caring for patients.
You know, I love surgeons that have a very strong faith, because if we can pray together before you put me under, the better things will be.
Absolutely.
So, okay. How did you decide to become a plastic surgeon?
Mm-hmm. Yeah, so I grew up in a small town in rural Alabama, and the only time we ever met physicians is when we had to go see them as patients, really. So we didn't even have a family doctor. I'm an indigenous American, so I grew up in and around my tribe's reservation. And so, quite honestly, I never really met a physician outside of situations where we were going to get some stitches or going for a checkup or immunizations before school. So for me, it was sort of a dream that became realized as I built skills over time. So on one side of my family, I didn't have a single person graduate from high school. On the other side, you know, my dad, he had graduated high school, but on neither side, no one had ever gone to college. And so I wanted to find a profession. Once I found my faith, I met my wife as a teenager, and her dad was a pastor. And so I found my faith. And once God found me and I discovered my purpose, that's when it was a game changer for me, really, because it changed my view from what can I get to really what can I give. And that's what medicine does for me. That's what surgery does. It allows me the unique balance of using the gifts that God has given me to try and be a gift for other people. And that truly is what I value the most, is, you know, finding ways to help people. And I don't think that we are built to help people with where we are. Okay. So I see this in surgery a lot. So a lot of surgeons will want to pull a patient to a procedure, and that's not what we're supposed to do. You have to meet people where they are. Sometimes it's on a certain level. Sometimes it's on a different level. And you can't get stuck in a box of only doing something one way. If you do that, you're going to miss a great opportunity to connect with people and help them. And that's what plastic surgery does with me. It allows me to use creativity. It allows me to honestly judge myself by looking at results, by looking at outcomes, by looking at relationships. And it allows me to, if I'm honest with myself, I can improve, and then I can improve the results and obviously then improve what we're doing with patients over time. So it's artistry, it's mission, it's an extension of love and compassion. And to me, that's not work. It's a privilege. I tell people all the time, growing up, I worked on construction sites, building residential houses, putting shingles on roofs in the summer here in Alabama. And what I do is not work. What my uncles do, what my dad did, what a lot of my friends and family still do now. That's work. What I get to do every day is a privilege. So I don't have to go to work. I get to go to work. And that makes all the difference for me, just having that perspective.
Oh my God. I love that so much because I definitely live by that. I don't have to do anything. I get to do all of these things. And I think that really changed my life once I started viewing things differently, just like that.
Mm-hmm. Absolutely.
So let's jump into that gift that God gave you of helping women have the body of their dreams. And with breast, I know there's a lot for my girls who are listening, if you're thinking about implants, I know that you've probably been online and you either read something about implants making you sick or about them being the wrong choice for you. And you have maybe decided, I don't know, maybe I do want to do it. I don't know what to do. So I want us to really talk about what are somebody's options whenever they want to do something with their breast, but maybe they're afraid of implants. What can they do?
Mm-hmm. Yeah, that's a great question. So Mavi, a lot of women will come in and they know they want something different than what they have, right? So it's like they're seeing what they look at every day and they know they want something different, but honestly, it's difficult to figure it all out because there's implants, do I need a lift? Then there's a whole concept of fat transfer. And then there's a concept of what's called auto-augmentation. So there's so many questions out there that patients come in with. And I think that understanding if you have questions, that's a good thing. That's actually the best place to be in. When we start consultations within our practice, the first thing I always tell patients is thank you. We're glad to have you here. And I always start by saying, if you have any questions, let's make sure we get those answered while you're here. But even if they come up, you can message us through social media. There's so many connection points. You can call us. You can come back in. Our job is to make sure that a patient is as comfortable asking and we can, and if I don't know the answer, look, I don't know all the answers, but we want to make sure they're comfortable asking and seeking for answers to their questions. And then we partner with them to find those answers. And that may be within our practice. It might be within someone else's practice. And it may be no surgery. Okay. So that happens sometimes too. But the important thing is exploring all of the options. And so I think the first question a patient has to ask herself when she comes in for a breast consult is one, what are my breasts like right now? And then objectively through the lens of a plastic surgeon, look at where your breasts are. Are they a little uneven? Are your nipples in a different position? Have you lost volume in certain areas? What's your skin quality like? And then after you just look at those objectively, try your best to take the emotion out of that because understanding that's a starting place. After you do that, then you're able to see, okay, the breasts are truly sisters and not twins. So there's this whole, one of the things I talk about, and I don't want to seem like I'm going off topic here, but in plastic surgery, sometimes it's difficult, Mavi, because what happens is we try to hit a moving target. And here's what I mean by that. So patients will come in and they are at one place, right? And you know what I mean. They're at one place. We get them to another one and then the target changes. So their expectations, if you're not careful, when you're going through the surgery process and you're recovering, your goals change. So you'll start in one place, you get significantly better. And then all of a sudden it's like, okay, I look better. I look good. But now I want to look even better. And that understanding that feeling is totally normal. Everybody, I would say probably 90% of patients have that feeling. And that, understanding that that's going to be there and that you are constantly always a work in progress. And so knowing your starting place is the first thing and then understanding what you want. So having those, what patients describe as their inspo photo, having that inspiration photo when they come in and then understanding, make sure your inspiration model is a match to the model that God gave you, meaning that your inspo matches your frame, your body type, your sun exposure history, your smoking or nicotine abuse or use history. All those things have to match up. And then we can decide on what might work best for you. And what's best for you might not be what was best for your best friend or your sister. It's all personalized every single time. The thing that a friend of mine who's a rhinoplasty expert down in Florida, and I'll drop his name. He's a great guy. We were classmates and really close friends. Dr. Ruslan Zarofsky down in Miami, Dr. Z. He does a lot of noses, and I send all my noses to him. He talks about how no rhinoplasty surgery is the same. And I think it's the same exact way with the breast. No breast surgery is the same. And while maybe two pair of breasts may look similar in outcome because the patients were very, very similar at the start, those two operations are still different for every patient. And I'm sorry, I may have went on a tangent. I apologize.
No, that is so good. You touched on something that I think we definitely need to talk about. The moving target. Oh my gosh. And I tell my girls, look, after surgery, you're not going to stop scanning up and down when you're looking in the mirror, and you will find something else that now bothers you. That's why I like with my one-on-one girls, I like to tell them, like, okay, surgery is done. You're through the recovery. It's time to move on to something else. Let's focus our attention on something else. Because if you continue to stand in front of the mirror and just analyze yourself to death, you will want more surgery. You will nitpick yourself you will nitpick yourself into another surgery. And you probably look beautiful and you look great, and you've already hit a goal that you had in mind, but now that moving target, now you want more. And now I tell them it's a slippery slope. It's a slippery slope down there to nitpicking, having another surgery, wanting more, expecting more, especially with my girls who this happens a lot with BBLs, where they're like, oh, I don't want too much. I just want natural. I don't want it to, I don't want people to tell. And then they go through it. They go have the surgery. During the initial recovery, it's a little bit more swollen. They love it. They're like, oh my God. Sometimes they're like, oh my God, this is too big. But sometimes they're like, oh, I love it. As it starts to go down and go down and go down, they're like, where'd it go? No, where's it going? That was swelling. And it's like, you think you want something until you're there and you're like, oh, I could do a little bit more. So you hit the psychology of this is so interesting to me. And also, I do want to instill a little bit of fear. If you are vaping, if you are smoking, no matter what, you're putting yourself at risk. If you try to trick your doctor and say you're not smoking, but you really are, or try to cheat the system somehow, like you pass the test, but you don't, y'all are crazy out there. I know y'all. So I know some of y'all are out there thinking, oh, I'll smoke and he's never going to find out. Your nipple will find out.
Yeah,
your
absolutely.
incision will find out.
Most definitely. Yeah, Mavi, I think that's a great point too. A lot of times people think that rules are set up to keep people out, right? But in reality, a lot of these rules and recommendations and suggestions, and sometimes they're hardline rules, especially around smoking, cosmetic surgery, they're not set up to keep you out. They're set up to keep you safe. And so it's the fences of life that keep you safe. And if we tear down fences, then bad things happen. It didn't happen because the fence was there. It happened because we went outside of the parameters of the fence.
Exactly. So, okay. That was a little bit of fear I wanted to put into you guys. Don't smoke because you will lose your nipple. So stop, please. Don't do it. Your incisions will suffer. That includes vaping. Any type of nicotine, even if the freaking thing says it's air, it still has nicotine in it. It still has something. So you're not puffing on air. There's something in it. There's nicotine in it. So even if the bottle says air, that's not air. Read the label.
Well, absolutely. And that's such a valid point too, because they'll say nicotine free on these packages. And what I can tell you is if it doesn't have nicotine, it's got something in it, or it has chemical ingredients that have been simplified and broken down. But when they act in the body, they're going to act in the same way on the blood vessels, on the tissues that nicotine does. Because you got to understand, they're in the game of making money too, right? So they want to keep you using, and they want to keep you feeling that effect. So, if you can quit, and I tell patients this a lot of times, if you can quit 4-6 weeks before surgery, and then of course 4-6 weeks after surgery and longer is better. But if you can quit during that time period, then you can quit for the long-term gain. And I've never had a patient who I've had stop smoking come back and tell me that they wish they would have started back smoking. It's always, I'm glad that I stopped. It changed my life in other ways. So there's these compound effects, there's added benefits on every side too. So yeah, that's my disclaimer on that.
Yes. So I think we gave him a good speech today. So let's talk a little bit about removing breast implants. So a lot of patients who have implants, and maybe they want to switch them out, and maybe they've heard some of the negative talk around implants, and now they don't want implants. Maybe they want fat transfer. How does that work with a procedure? Like if they have implants and they want to take them out and they want to do fat grafting or something else for volume, how does that usually work for them?
Yeah, so that's a great point. So in women who are looking to remove their implants and potentially do a more natural approach, it all depends on what has been left behind. So it's not about so when we do implants, many times it's about what you put in. It's also to a little extent about what you remove or what you shift around. But when you're placing implants in a primary case, it's what you put in and where you place it. When you're doing a removal without a replacement with a lift and then fat grafting, and I usually look at it like this: it's removal, auto-augmentation, and lift, and then, fat transfer. When you're doing that, you are replacing and lifting, and what has been left behind is more important. And that's what defines what the breast will be like. So as we talked about earlier, knowing where you are and where you would like to be, two most important things. And then understanding both longevity. So if you have an implant in, there's always long-term things that considerations that you have to have. Whether that's screening, whether that's monitoring your breast tissue, whether that's monitoring the implant, whether the implant is going to change and drop, if the capsule is going to harden or shift over time, if they're going to bottom out, if they're going to fall into your axilla. You're always going to have to worry about that, right? There's never a safe time when you don't have to consider it. Now I say worry, but consider. It's always in the background. And for some people that's okay. They can kind of live with that little bit of background noise, and some people can't, and that's fine too. So on the removal and replacement side, it's all about how much tissue you have left, where that tissue is located, and what you want. So if a woman loves having upper pole fullness, and let's say her implants, they retained a relatively high position, few do for the long term, and she has very little breast tissue and she's lean and athletic, it's going to be really, really difficult for me to mimic what you had or to recreate what you had with a lift and fat grafting. But what I can do is give you a breast that matches your build. I can give you a more athletic looking breast. We can lift, we can reshape it instead of discarding. A lot of times when I do a breast lift with implants, I'm discarding a fair amount of breast tissue, okay? 150, sometimes 250, even 300 grams, because I'm a firm believer, and I learned this since I've been in practice the last 6 years. When a person wants an implant, they want the implant to shape their breast. Whenever a person doesn't have an implant, they're using the breast to shape the breast. And that sounds funny, but that's two different things. So if I'm doing a lift with an implant, I'm not going to depend on the breast tissue for your shape. You want the implant. You want the round look. You want the projection. So I need to make your breast fit the implant. But whenever I'm removing an implant, I'm going to make your breast fit your body. So those are two different things, and I think both have great results. Now, how much can a woman expect to receive or achieve? How much of a result? Cup size, roughly can one expect to achieve with fat transfer? And I think safely, as far as of a retention rate, one depends on the size of the patient, the size of the breast, a woman's frame, and how much fat we're able to harvest. But usually the maximum amount is probably about 300 cc's per breast, 350 cc's at maximum, for a woman with a taller build, broader shoulders. We could probably get that much in depending on her soft tissue envelope, how much things stretch. But what does that translate into? That translates usually into no more than a cup to a cup and a half, maybe 2 cups at the most. So you're not going to be able to go, as far as you will with an implant, never. And then you got to expect about 10% to 20%. In our practice, we do use Revolve to process our fat. I do it for all of my fat transfer cases. I've had good results with it, so I haven't changed it. And that's the reason why. And our fat retention rate, when we measure that in terms of measuring the circumference of the chest, and we look at what our women look like after surgery, we look at what they look like before surgery, we're usually getting about 85 to 90% retention, which has been excellent for fat transfer to the breast. I hope that answered what you were asking.
Yeah. Tell us about Revolve. So for our listeners who don't know what Revolve is, explain it to us.
Mm-hmm. Yeah. So Revolve is a fat processing system that we use in fat transfer surgery. Revolve, that is just a name brand for it, but Revolve does a couple of things. It allows you to wash and cleanse the fat. It also allows you to suction and harvest the fat through a sterile process. So it's in a closed system. So when you suction the fat out, it stays inside a sterile closed system, which all fat transfer should be sterile anyway. But it stays inside of a closed system, which I think is really important. And then you're able to run fluids through to wash and rinse impurities from the fat. So, what impurities would be there? Well, blood for one. Also, there's certain layers within the fat that you don't want. So, serous fluid, tumescent fluid. There's what I kind of I call gristle between the fat. It's the little septations or fascia that's located between the fat. It helps to filter those out. So the fat is transferred into a filtered canister that's on your back table, and then it filters the fat. You rinse it with whatever, with lactated rings or whatever fluid you have there, saline, and then you centrifuge it. And what that means is you spin the fat around in a very safe and non-traumatic way. It helps the fat to tumble, and the fat that you have left in your device that you then are transferring into the breast, it has a less oily component. It has more of the growth factors that you want, more of the stem cells that you want, and a higher quality fat that's there. And that's the kind of fat that you want to be injecting into the breast. You want to handle it carefully. You want to inject it carefully, and you want to do it the right way. Because to me, even if if someone has got a lot of donor sites, I still think getting the best quality fat and doing it in the most efficient way is it's key to getting good fat grafting survival. And that's what you're doing it for. When you're transferring fat, you want it all to stay behind if you can. Mm-hmm. And Revolve helps to do that.
I love that. I love Revolve. So for fat transfer, where's your favorite place to liposuction? Where do you think the best fat comes from?
I think the best fat probably does come from the abdomen. That's my opinion. What I will tell you, that's kind of a loaded question. So where's the best quality fat come from? It does come from the abdomen. And when you look at fat, you can look at superficial layers of fat. There's the deep layer of fat. There's a sort of a pale appearing fat. There's then this, this lobule sort of golden fat. That's the gold standard. To me, that's a well vascularized, appropriately sized fat that we're transferring at that point. And look, I actually think I'm happy we're on this topic, because I talk about it all the time with my staff in the operating room, and they've seen it and they notice it more than I do. We mentioned smoking before. Smokers have different quality fat than what a non-smoker does. It's more pale. It's not as, for lack of a better definition, look, I'm just a simple Alabama guy, so it's not quite as fluffy. I don't think it's as robust or as robust. And then as we change the quality, as we age, the quality of fat changes too. So there's so many factors that go into this. And so when you talk about where's the best donor site, I do think that it depends on the person. It depends on where they carry it. You can almost feel and know and have an idea, but I've seen the belly. I think the central abdomen is probably the best location. But where do I like to do it the most that I think complements breast surgery? The axilla, for one. If someone is doing, breast surgery on you and you're not addressing the axilla, and sometimes in some patients when they have a lot of redundant skin, it's two different procedures, and you have to be clear with the patient. We're operating on your breast. We're not chasing things all the way around. We're not doing a bra line lift. And when they need to know that, because if you don't address the axilla in some way, whether that's extended excision, removing skin, or doing liposuction, you're not going to get the most complete breast surgery. So could you get a good breast surgery? Most definitely. There's no doubt about that. But are you going to get the most complete surgery for your time, energy, and effort? I don't think that you will. So in a breast situation, flanks and axilla, so the lateral aspect of the breast, and even up along the upper lateral aspect of the breast, that's going to be the more sort of bargain for your investment, your return of investment. But as far as what area do I think in plastic surgery has revolutionized or changed my results, it's not high definition or moderate definition. It's the flanks and back. If you do the flanks and back and you do that well, I think that takes a standard tummy tuck and it makes it into a phenomenal tummy tuck. And that's been the biggest shift in pure liposuction within my practice, is just taking that extra time, really going almost from the shoulder blades all the way down to the hip bones and making sure you clear everything out on the backside. And that's probably a little bit different of a conversation, but the quality of fat matters.
Such a good conversation, because for women, I know you see this, and I've seen it thousands of times, where women are left boxy, looking boxy after their tummy tuck. And it's because multiple reasons. They didn't know that they could have liposuction at the same time to the flanks. They didn't know, or maybe it was itemized out on the quote and it made the quote more expensive than what they were expecting to spend. So they take it off, not knowing that that's what's really going to make your result go out of the park. And what was the third reason? I think those are the main two reasons why they don't know to ask for it. It's some surgeons don't recommend it. They don't include it with their tummy tuck, which I think should be a crime. Don't leave my girls boxy. Please do a little flank lipo. So I think really talking about that is very, very important for my listeners who are considering an abdominoplasty, and they know what they don't want to look like, but they don't know how to get there, which is actually why I started my show. My show was to educate women, to help them understand what they're going in and what they're asking for.
Yeah, and the point you make there is so important. And I would add, from a physician standpoint, there's two reasons probably, and there are multiple reasons, but the two main reasons on the physician side that I could see why a surgeon might not push for 360 lipo or flank and back lipo, it's because of time, right? There's a position change, and time and effort. That's one of those reasons, even though it's kind of two, but time and effort. Okay. Because it's more effort. Like when I do a tummy tuck, I want to make sure that a person understands during that consultation, if you don't do this extended lipo, then you're basically getting a different procedure. It's not the same procedure because the outcome isn't the same. So sure, is it are we doing 2 hours of lipo and then doing a reposition, which honestly translates into probably 2.5 to 3 hours by the time you reposition, reprep, and get everything set up for the front side. So you're adding 3 hours onto the surgery. So some surgeons, they have ADD. They don't want to add all that on. But if you're not adding that, then I think you're getting an outdated abdominoplasty in 2025. You're getting the abdominoplasty of 2000 or of the 1990s. So you have to add that. And look, I've been at both ends of the spectrum. So when I first started, I was honestly figuring a lot of this out. And, I wouldn't do lipo because I was afraid of tissue necrosis, which is a real risk. And then I started doing a lot of lipo, and then I started doing a whole lot of lipo and high definition and Vaser. And then I came back to somewhere in the middle. I think a moderate definition for the long term, for the safety of your skin on your abdomen, for your appearance, I'm talking, 5-7 years, not just, a year to 2 or 3 years, for the viability of your skin, for fibrosis and all those things. I think right now, moderate definition is better than high definition and sculpted. And I think flank lipo, upper back lipo is king. And then lastly, understanding your body type too, and knowing where you carry your fat, intra-abdominal or underneath the skin, so extra-abdominal fat or subcutaneous fat, knowing yourself, and then you can stay true to yourself, to thine own self be true. So you got to know yourself to stay true to yourself. And then when you do that, you can get better results. You can have a better conversation with your surgeon as well.
Absolutely. You have just been such a pleasure to have on the show. We've talked about so many things. I feel like we could keep talking forever because there's just so many different topics we could touch on. If my girls wanted to come see you, how could they find you?
Yeah, so you can find us on all the social media platforms. We're on TikTok at Real Dr. Tony. We're on Instagram with the same handle. That's Real Dr. Tony. Our Facebook is just Dr. Tony Weaver, or if you look for Weaver Plastic Surgery. We're in Huntsville, Alabama, which is North Alabama, but it's the fastest growing city. And I would argue it's by far the most modern city in the state of Alabama. Alabama, sometimes, we've been held back by, our reputation in the past, but it is a phenomenal state with phenomenal people. Huntsville per capita has more PhDs than anywhere else in the country. We're a engineering and we're a NASA hub, much like Houston was for a while. But we've got great people, highly educated, but more important than that, we've got people that love people, and that to me has been the biggest thing. Our city has grown so much in the greater Huntsville area. I'm in Madison, Alabama. We've grown so much, and I see patients from out of town all the time, and so we've got great resources within the community to help facilitate that. I love using technology to have visits with patients, whether it's, through platforms like Doximity, or through other media platforms that allow us to securely see patients, have conversations with you. And we love dialogue online. So message us, my staff and myself. A lot of times it's me directly getting back to you there with my staff. We like to hear from patients, prospective patients. And even if you reach out to us, if we're able to provide you with information and that information is then utilized, and then you go somewhere else, well, that's fine too, because our job is to help you. If it's with us, that's wonderful. If it's with someone else, that's great too. I always tell my patients that if someone tells you not to get a second opinion, you should be getting a second opinion. And I feel that way. If you see me and you want a second opinion, get a second, get a third, that's totally fine. And then go with who you vibe with, because those are going to be the surgeons that help you when something does happen. And I pray that nothing ever happens, but when it does, you want to be with a surgeon you like, and with a surgeon, honestly, that likes you too. That makes a tremendous difference.
Oh, you hit the nail on the head with that one. Thank you so much for being on the show, Dr. Weaver, and I hope to have you back soon. With that, you guys, I'll see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board-certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.